Now we'll quickly try to move to the next discussion we should be having, and this is an artery, and of course an artery in the foot. Okay, so that is the lower limb and the lower side almost going out. So the lateral plantar artery. So look at this. This is what the lateral plantar artery. Please, are you seeing it? It's not on the dorsum. It's in the back of the foot. Okay, this one, so you can also see it. The lateral plantar artery, that's there is an artery under your foot. So let's talk about its anatomy. So it's actually a larger of the two terminal branches of the posterior tibial artery, and it runs oblique around across the sole of the foot, and it's also a member of a group of blood supply under the foot that we call the plantar arterial arch. Okay, so it supplies most of the plantar surface of the foot, including the toes and everything. So what's the origin? Arises from the posterior tibial artery beneath the flexor retinaculum, posterior to the medial malleolus. So the other terminal branch is the medial plantar artery, which we'll talk about it in the next video. But this is a medial plantar artery, just so you know. Okay, so what next? What's the cause? It runs obliquely, laterally, and forward across the sole between the flexor digitorum brevis and the quadratus plantae muscle. So it curves medially at the base of the fifth metatarsal bone. It continues as the plantar arterial arch, which lies deep in the sole. So usually at the level of the base of the metatarsals. Okay. Beautiful. So what are the branches? It gives the muscular branches that surround the plantar muscles, the cutaneous branches to supply the skin, perforating branches, the digital branches, and the plantar arch branches. So what's the distribution? It gives blood supply to plantar muscles, the skin of the sole of the foot. It gives blood supply to the toes, and also contributes to a rich blood supply network that we call the plantar arterial arch. So it's related. It runs between the flexor digitorum brevis and the quadratus plantae muscles, though they might not be listed here because these images are just towards what do they call it, arteries. All right, so moving forward, what is the clinical importance? Is the main blood supply to the sole. All right, collateral cycle, we learn about it because of the collateral circulation. In case there's an issue, this can still maintain blood supply. Then the surgical relevance, of course, when you want to do foot surgeries, you should know that there's a landlord there called the lateral plantar artery. Then also risks to traumas. You can step on something, it can pierce the artery, causing a lot of bleedings there.